There have been a lot of sort of big groups that we had to tackle as we've gone through culture care here at Tampa General Hospital. Probably one of the easiest groups starting out was the senior executive team, because our CEO was so on board with this idea, and I mean, ultimately he had put together this incredible strategy for the next few years for our hospital, and so we sold him on the Peter Drucker quote, "Culture eats strategy for breakfast."
There was no definition of, okay, what do we have to do differently if we're going to survive in the changing healthcare environment. And so the board recognized that and developed a strategic planning committee and brought in an outside consultant to work with the committee and the leadership that was here to develop a strategic plan for the next 5 years. And it just seemed to me that the things that are in the Speed of Trust seemed like to be a natural way to make the strategic plan accelerate. And so this seems like the perfect vehicle to do that.
One of the conversations that we had before we made the decision to go forward with this was, we have so many things on our plate right now. We have so many competing priorities. How on earth are we going to find time to do this on top of everything else we have to do? And I said, if we can do the Speed of Trust, it's going to make everything else we try to do easier. So I think that with all of the changes in healthcare, we're really running fast to try to keep up, and not only keep up, but get ahead. And I think that having these tools and improving our working relationships will help us a lot with the objectives we have ahead of us.
The culture is going to change dramatically, and culture care was our way of being very intentional about how that culture was going to change.
First of all, I think about culture and the need for culture change in healthcare, and especially in what I'm doing and focusing on in the quality initiative. It's well known that healthcare needs a culture change to look at what we do differently from a quality perspective.
I think the idea in bringing culture care here was to look more at our patient satisfaction. What do we need from, what do our patients need from us, and what do we need from each other in order to be able to accomplish the goals and raise our patient satisfaction scores to the highest possible level that we can.
Right before we started this process, we got a baseline for what our employee engagement was at, and across the board again, we really weren't where we wanted to be with employee engagement. When we presented those results to our leadership staff, we actually immediately made the connection between employee engagement and trust, because there's all kinds of research that shows that if you can improve the trust that employees have in the organization, it's going to impact engagement, which we also know then has a direct line to impacting patient satisfaction. So the culture at Tampa General Hospital has been changing because of a variety of things. The biggest one being that the healthcare market has changed so much over the last few years, and it's going to continue changing. Some of those changes we're really certain what's happening, and other changes we still don't know what's going to happen, and it could change every 4 years. And so we really needed to get to a place where we could deal with change more quickly, and that's one of probably the biggest things that culture care has done for us, is it's really given us a process to start building the trust between groups so that when we do need to change based on the market, we're able to make those changes more quickly.